I am Reverend Frank Wilson Jr. With the 67th Precinct Clergy Council, located in Flatbush, East Flatbush, Brooklyn. We are a we definitely bring welcome to the work that you are doing within the this endeavor, and we are just grateful to be on the call and be in partnership with you. Just to kind of give you just a recap, we are an organization that works heavily with gun violence. We've been doing this work for about maybe 10 years. We create strong atmosphere for healing families who have fallen victim to gun violence, provide resources, support to those families. We are just grateful to be here doing this work, and looking forward to any of the things that are coming soon. So thank you so much for allowing us to come on and give welcome. Thank you.
Thank you. And I know we have Reverend Venkis on the line. Would you like to give words of welcome, or would you like to stick to the end?
Well, I'll just say hi. It's good to see you, Helena and Susan and everybody else. And we're actually a founding member of NIDUS going back many years. And it's just been our privilege and our pride to be able to join in these in the webinars and all of the seminars that NIDUS has been a part of. And I think this is particularly important, these updates to our communities. The New York Conference takes in all of New York City, Long Island. We move up into the Catskills, up along the Hudson River, and we also take in the western half of Connecticut. So it's a large geographic area. So getting this information out to our local churches and to see how our local churches can be part of the network for information, but also part of the solution to all of this is critical. And to Pastor Wilson, a number of our churches, Vanderveer and part of the God Squad, Gail Douglas Boykin is part of that, and she's actually a former police officer. And so we're just grateful to be here. And once again, our thanks to Susan and Helena and NIDUS for hang on one second, sorry about that, for conducting this. So thank you very much.
Thank you both. We're grateful for all the work you've put in to get the word out to your clergy about these webinars. So we hope that the information that I helped present today is useful to you all, and that you're able to get any questions you have about the vaccine answered today. So I'll go ahead and dive right in. Hopefully this is probably Zoom number 1,000,002 for you all, but we'll just remind you to mute if you're not speaking. And if you have any technical difficulties, you can go ahead and type in the chat or email Susan Palevsky, whose email is listed here, if you'd like to note it down for assistance. At the end of the presentation today, you'll receive an email from NIDUS. The email will contain a link to an evaluation. And if you fill out your evaluation, you'll receive the slides from today, the information, and a recording of the video today. I think that is all of the housekeeping that we have covered, so we can go ahead and dive into the content. My name is Helena Duran. I'm sorry for not introducing myself sooner. I previously worked with NIDUS in their Faith Sector Community Preparedness Program. And I'll be sharing information about Toolkit today. And we have a representative from the New York City Health Department, Yeshi Braddock, who plans to join the call and share information about the vaccine. Our facilitators today are Gabrielle Sclafani and Susan Palevsky, who are both on the call. So an overview of what we'll cover today, we'll try to make it as interactive as possible to hear as well what you all have been adapting with your services and how you've been providing spiritual care to your congregants during the pandemic. And we'll also share information about how to use this toolkit. So this toolkit was created specifically for faith leaders to write a written plan about your congregation and how you can have an emergency plan on hand during this pandemic to utilize and organize your work. So we'll share how the toolkit works, some different sections within the toolkit that might pertain to the work you're doing, and the templates and tools we have for you to utilize that make it easy to implement. And after that, we'll have updates about the vaccine and share a little bit about additional resources for religious leaders that you can hopefully spread the word about. We have time for Q&A at the end of each section, so I'll make sure to pause and answer questions along the way. So a bit about this pandemic planning toolkit. If I could ask Susan to share the link to the toolkit in the chat so you have easy access to it through the presentation. The toolkit was adapted specifically for the New York City faith sector in response to COVID-19. It includes considerations about how congregations are structured, how you might have a network, belong to a network of churches, or how you might answer to a judicatory body. It also takes into consideration ritual and religious worship and how to plan around those in an emergency or a crisis. And it also helps in creating plans for congregations who provide social services. So we know that that structure is unique to you, and we hope that this toolkit provides the tools and resources you need to write those plans in a way that's specific to your context. All right, so a quick overview of the toolkit. The quick guide starts on page 9, and that's a series of checklists to get you started. So if your leadership were to sit down and gather to discuss the emergency plans you have in place, you might start at page 9 and work together through that to see where the gaps are in your written plans and what you might need to complete. The planning guide begins on page 25, and that's the majority of the content of the toolkit, is walking you through the guide. So page 25 to page 70 are the planning guide. And then starting on page 71 towards the end, there's some template messages that you might send out during a pandemic. And so those are there. And at the very end, we have supplemental documents that help structure some of the worksheets to help you write your plan. So when you open the toolkit, the pages are laid out in a way that we hope is easy to understand and utilize. We really tried to make this actionable. We tried to make it simple. We tried to use plain language so that your leadership can really sit down and put these words into action. So here we have some gray boxes throughout. And so those gray boxes will tell you a little bit more about where else in the toolkit you can find information that relates to this topic if you need to find more detail. Also throughout the toolkit, there are blue boxes sprinkled throughout, and those blue boxes identify that, hey, there's a template or instructions for how to do this towards the end. And so those blue boxes will be helpful in letting you know where you can find some templates to work on what's being discussed in the toolkit. There are also some visual graphics throughout to keep it interesting, checklists where we can so that it's simple and easy to follow. So we were hoping to kind of break this information down in a way that you all can sit together and work through it. All right. So at the start of the planning guide, before you begin putting pen to paper, it walks you through describing your community. So before you can write a plan for your community, you have to figure out who you're writing the plan for. So to keep it simple, we ask you to separate into 2 groups of people. Your communication and your continuity plans will revolve around planning for these 2 groups. So the first group is your leadership and staff. So this includes your management, your lay leadership, and your ordained clergy. It'll include any paid staff that you have, any volunteers who are providing these services and working for your congregation. So that is your leadership and staff. And the second group is your congregants, your clients, and contacts. So if you provide any social services, we're referring to those clients of any food pantry that you might run from out of your congregation, or clients of any 12-step programs that might be tenants in your facilities. And then your congregants, of course, are those who gather and worship with you. And your contacts would pertain to any vendors or contractors that you have. So this is a page in the toolkit, and that gray box at the bottom shares what page you can find more information about this within the toolkit. So that's an example of how the toolkit would work. Here we have an organizational chart. And so the way that we want you to describe your community of your leadership and staff is to create an organization chart. So many of you might already have this in place. That's great. If you don't, it's a great place to start when you're writing your plans. So within the toolkit, we have example churches, and we also have a blue box on this page in the toolkit. So that highlights that there are instructions on how to make one at the end of the toolkit on page 90. So it'll provide you with a worksheet so you can begin to write one out if you don't already have one. So once you've identified your two groups, your staff and leadership, and then your congregants and clients, you'll want to plan your communications for them. So we're starting with communications. I imagine this is the bulk of some of the work that you've been doing during COVID-19. So first, the toolkit wants you to identify what information you want to provide communications about. So this bullet point list shares some information that you might want to share. You might want to share about continuity of operations with your staff. So who's going to pick up which responsibilities during this pandemic. You might want to share about delegation of authority. So if you're unable to complete your tasks, you need to report to your supervisor, and your supervisor will identify the next person. You might want to communicate with your staff about human resource policies, and I'm sure those have changed throughout COVID-19. This is something that is kind of ever shifting, and we know that you've probably kept them up to date about if you're feeling ill, please don't come into the offices, or if you need to take sick leave, or what working from home looks like for all of you providing services. Another thing that you're probably communicating about is information regarding vaccinations. We hope that this is information you're sharing with your staff and sharing with them the links that are available for how to register when they become available. In addition, we hope you're sharing about training information, hopefully some personal and family preparedness information, and also general hygiene. Maybe you're sharing a protocol for safety within your congregation's offices that they should follow if they ever have to come in to do anything. So this is some of the content of what you'll be sharing. I like that it lists things out in bullet points within the toolkit because it makes you realize just how much you are communicating about and that you should write a plan around it. Information that you're sharing externally, I'll call it internal and external. So with your congregants and with your clients, the information that you're sharing out to them will probably be about changes to services and programs and rituals. We know you've been adapting much of the work that you do throughout this pandemic. Any special hours of operations if you provide social services from your congregation. Any general hygiene information or even core 4 messaging from the health department. We hope that this is something that you're sharing out with your congregants. Information about the vaccine when it becomes available. And some of the same information that you would share internally with your staff as well. We also want to highlight that hopefully you're sharing information about partner organizations that are providing services. So if you personally don't run a food pantry or any type of food provision service from your house of worship, but you know of one in your neighborhood that is, we hope that you're spreading that information and sharing good information with your congregants. And so knowing that you're doing all of this work, the toolkit helps write a plan around how you'll do that. The plan also focuses on the protocols that you'll use to writing these messages. And so I hope that having something down in writing allows you all to assess the structures that you've come up with during COVID. I know when COVID first hit, we were all kind of scrambling to get these services up and running and get the information out as quickly as possible. But I hope now is a good time for us to assess what we've managed to pull off during COVID, and that we're able to write it down and really document what worked for us and what didn't work for us, and is the stuff that we're doing now sustainable? So once you've decided the content of the information that you'd like to communicate with to your 2 different groups, your staff and leadership and your congregants and clients, we want you to look at the methods of communication that you're utilizing. So for your leadership and staff, you might have settled on a method of communication that you all use for your information sharing. So that might be via email. You might have sent out memos that have gone out just to your staff and volunteers, or your judicatory body might have sent out memos to follow during COVID-19. So different modes of communication work better for different types of information you're trying to share. And the toolkit kind of highlights that and allows you to make a plan around which mode of communication you'll use for certain information sharing. With your congregants and clients, we hope that you've figured out ways to get the word to as many people as possible, but we know that social media is a big step in that. Many of you have vibrant Facebook pages and even Facebook subgroups as well. for your congregants to gather and share information effectively. You might be sending out mass emails. You might have a website that you've ramped up during COVID-19 to share updates and information. You might have flyers and posters that you've posted to your physical location to share important information to people who might walk by in the community. You might be hosting webinars or conference calls to have prayer groups. And so these are the different methods that we wanted to highlight. So I'm curious to know, we highlighted a few of the methods of communication, but which forms of communication have you all used during the pandemic? So we have a poll question. I think Susan is able to launch it for us. And I'd like to see what types of communication has your house of worship used during the pandemic to share information. You can check off as many as apply. All right, I see the votes rolling in. I'll give it a few more seconds. All right, so, ooh, they're still coming in. Give it a few more seconds. All right. Susan, are you able to share? Excellent. So it looks like the most used methods are email and conference calls. Excellent. That you're using to communicate with each other. We have a lot of social media and phone calls and phone trees and direct conversations as well. Excellent. I love that you've had the capacity to have those direct conversations. Wonderful. All right, so I'll go ahead and stop sharing those results. So part of the toolkit are these worksheets towards the end. So we wanted to show you what one of the worksheets would look like. So this is, when you're planning your communication, a message template for providing risk communication. So when you're providing a message, there are 6 basic emergency message components, and they're listed here with blanks next to them. So you can make sure that you're including all of the components that are best practice for including when you're sharing risk information with people. At the top, it's got some helpful tips to keep in mind. In the middle, there's some boxes that have you kind of zoom in on who your audience is, the purpose of your message, and which mode of delivery you're going to use. And that'll really help kind of narrow down the context of how you're writing your message and what language you'll use. So this is an example of one of the resources in there. I hope it's helpful when you're writing a message, just to make sure that you've included all of the different pieces that you want to include before sending it out. Another supplemental document at the end of the toolkit on page 91 is how you'll communicate changes to any services, which includes worship services and other social programs. And so this kind of walks you through, and if you answer the questions, it helps refine the language that you're using and make sure that you're addressing any questions that people might have in a pandemic context. So I know that once information gets put out, there are a lot of questions in response from the community. And so in walking through this and making sure that you've answered certain questions, you're putting out a communication that is whole and complete, and hopefully minimizes the amount of question answering you have on the back end. So in addition to those worksheets and tools that you just saw an example of, there are also template messages that are pre-written for you. And so these are form documents. They have the content in place, but leave information specific to your needs blank so that you can fill them out. So you can fill in the name of your church, and you can fill in any of the specific information that you would put at the top. There's a spot for you to put your logo at the top of the template, for example. But the messages are pre-written with COVID-19 information in them already. So the 4 template messages include a message about getting ready for COVID-19, if you're not feeling well. The third one, staying healthy. I think this is something that we'll want to revisit now that we have a strain that we know is spreading faster than other strains. So re-upping on our mask wearing, on our hand washing, reminding ourselves of the core 4 information that can really help keep us healthy from a strain that we know is spreading more rapidly. So re-upping on our staying healthy. And the last one is changes in congregational programming. So I'm sure this is a message you've sent out before. If you haven't created a template for it yet, internally, we include a template if it's helpful for you. All right, so once you've covered your communications, that's the first half of that planning toolkit, we'll have you planning for your continuity. So we know that during the pandemic, you've been able to alter with much patience and reworking your celebrations, rituals, and ceremonies to create meaningful worship for your congregants during a time when meeting in person has been really challenging. And so the toolkit will help plan ahead for how you'll maintain these required rituals that add that meaning, structure, and dimension to your community life. So we know that this is planning that you've already done in many cases. We're almost 1 year into this pandemic. But even in looking at continuity, how are you going to continue these services in the next few months? And are the plans that you've made so far sustainable? And so walking through the toolkit will really help you map out what you have been doing and how you can make it stronger. So 3 pieces for planning continuity are listed here. The first is you'll want to identify your essential functions. So these are the vital tasks that your congregation does that serves your community, that you're looked to provide. The second piece is identifying your orders of succession. So who is completing these vital tasks? And are there people who are backups who can complete them if that person becomes unavailable? With pandemic, we know that we're dealing with the spread of illness. And so if somebody is out for a week for whatever reason, identifying who's in charge of completing that essential function and having that pre-written. And the third is delegations of authority. So especially in positions where the task or the vital role that is played is quite important and has a lot of authority, you want to make sure that there is a plan in place for how that transfer of power happens. So if your lead clergy is out, are there a set protocol for who would lead worship that week? So we'll dive into each of these a little bit further. When you're deciding what your essential functions are for your congregation, you want to look at what has to be performed during or immediately after an emergency. Many congregations now have been able to ramp up and add more and more things to the things that they're providing remotely for their congregants. But I want you to think back to those first few weeks when COVID-19, we were still unsure of the threat, when we weren't sure if we were going to be able to utilize our space to worship, when we weren't sure how long it would be where we were out of our spaces, where we couldn't gather. And so back to those early days, what were the first few things that you prioritized as a need for your community? What were the things that you as a congregation said, these are the things we cannot let slide. These are the things that we need to provide to support our community during this emergency. Those are essential functions, and not just supporting your community, but also supporting your congregation itself. So we want to include in your essential functions things like finance, payroll for your paid staff. Those are the things that you have to plan for early on and in the beginning. And then everything else would be considered a non-essential functions. So these can be deferred until later. They could even be deferred until more stability is found. So I mentioned before that congregations have added on more and more services as COVID has continued and we've gotten used to meeting online. They've created a weekly prayer service that they didn't have at the start, or they've resumed religious education courses online. So these would be non-essential at the start, but can always be added on as you acclimate to the new normal during a crisis. I encourage you all to look at your mission statements when you are determining your essential functions to see if there are any mission essential functions. These are the things directly related to your congregation's mission. And so sometimes your mission essential functions will be determined to be essential, and sometimes they'll be deferred. So we have an example of that on the next page. Within the toolkit, this example is listed. But for example, with this house of worship, they've determined that their regular worship service is a mission essential function. So for your church, it would be your Sunday service. and that you have essential supporting activities to support that essential function. So for your worship service, you might need prayer books or access to sacred texts. Your clergy might require wearing ritual garments. So these are those supporting activities to support that essential function. This congregation decided that their deferrable function would be providing general religious education. So while religious education was part of their mission, they determined that it wasn't contributing to life safety and it could be deferred to a later time. So this is another filter that you might want to look at when you're looking through all of the functions that you all provide. What contributes to people's life safety and their wellness, and prioritizing those. And that deferrable supporting activity would be maintaining the supplies and necessary things for that religious education course. All right, so within the toolkit, there are lists of functions that might be considered essential. So for congregational services, we have a list here of things that you might decide together as a group that they are essential. I want to highlight here that when you gather to determine what your essential functions are, you'll want to make sure that your leadership is in the room and that you're including everybody who needs to be included in making these decisions. And so this might mean that you have your clergy in the room. It means that you might have certain staff members in the room, key stakeholders, anybody from an organizing body, that you have these people in the room making these decisions. Your plan is stronger when you've included all of your key stakeholders in the writing and the making of the plan. All right. So in addition to the services that your congregation usually provides, I think you all have seen this, there are certain disaster-specific services that are added on. So during this pandemic, you're also, in addition to the things that you usually do, promoting coping and safe practices among staff and congregants. You might be recruiting specially trained volunteers to provide those social services that you want to provide to your community. Might be practicing reciprocity between faith communities. So this means if you are down the street from another church and you all are either sharing a large space or you're providing social service volunteers for each other's services. And you're also communicating risk. And I think this is the bulk of some of the additional work that you've been doing during this pandemic. Apart from the spiritual care and emotional support you provide, apart from creating safe and meaningful ways for people to worship, you're communicating risk with them. So you're offering timely, accurate information. We know that people look to their faith leaders as a source of information in times of crisis. So you're there to inspire, inform, and educate. And that's really a function that you play within your community. And this is an additional task during a pandemic. So we've got all of those things that you've added on as well. So we've got a second poll question for you all. Do you all have a order of succession or delegation of authority plan written? I'd like to know if you all have a plan for who would take over each essential function if that person was no longer available. I'll give it a few minutes for you all to vote. But do each of your staff members or volunteers know who would be in charge of their tasks if they were unavailable? All right, we've got a few votes in. I think we'll end the poll. Thank you. All right, so it's pretty good. We've got over a third of you saying that you do, which is great. It's higher than in other webinars that I've held before. But yeah, a majority of you do not have order of succession or delegation of authority plan. So I asked this just to highlight and see where there are rooms to improve and how we can utilize this toolkit. Thank you. So in creating an orders of succession plan in the toolkit there on page 53, there's a chart that you can fill in, and we hope that it has all of the pieces of information you'd want to collect when you're creating an order of succession plan. So we hope it makes it as easy as possible for you. So here's what the chart looks like. Let's see, we've zoomed in. This function on the left-hand side. So what is the task or the essential function that you've identified? And then the position title of who it is that is responsible for that. And then the name of the person who's currently holding that position. You want to include their contact information. The more contact points you have, the better. And any additional information that you'd want to include. So once you've listed the main person who's in charge of that essential function, you'll list 3 alternates below them. And so this is considered best practice to have 3 alternates for every essential function in an emergency so that you would be able to continue to function and provide those essential functions were anything to happen. So here on this next slide, we've actually filled out some information as an example. The example here is about a feeding manager. So this is the person who manages the preparation of food and feeding of community members. So this congregation has a feeding manager, presumably for a social service program that they provide. The current person in that position is Dr. Jane Doe. We've listed this example, office, cell, and email, and then notes about what they manage. And then below that, you'll fill out their alternate feeding manager. So the toolkit reviews this, but anytime that you put somebody's name in as an alternate, they need to be informed of that. This shouldn't be information that is hidden away once you've written this plan and gone through all the work. This isn't a plan that we hope sits on the shelf. We hope this is something that is a living, breathing plan that you all utilize to organize the work that you do. So here are the examples working through and any notes that they have in addition. And this is how you'll hopefully fill out your orders of succession plan for all of the essential functions that you've identified. All right. So now we want to talk a bit in the toolkit about volunteers. So we know that within congregations, because of their structure, much of the work might be completed by volunteers. This can present some unique challenges during an emergency. Volunteers often have other jobs which they must perform, or in the case of COVID-19 and the pandemic, they might be elderly or in a higher risk category, which immediately puts them more at risk during this emergency. So the toolkit has some planning preparations that you can do to better support volunteers. So if you rely heavily on volunteers, check in on them early, reinforce messages about personal preparedness and household planning. The better prepared your volunteers and staff are in advance, the more you can rely on them throughout the pandemic. Find out early if your volunteers need any assistance. Make sure that their needs are met as they're providing essential functions for you on their own time. And also check in on their availability to assist your congregation and if their availability has changed for any reason during the emergency. Check in with volunteers and also your staff if they're in a high-risk category identified by the health department. You'll want to check with them to see if they have availability and to consult with their healthcare provider if they have any concerns. So these are all ways that we can protect our volunteers. Often HR applies mostly to your paid staff. And so this is a way that we can protect our volunteers in ways that they might not be protected. All right, so in planning for your staff, prevention is one of the most effective methods to make sure that your staff are available during a pandemic. So you want to consider certain measures to help prevent COVID-19 from spreading through your staff. So this is a helpful checklist for your staff to sit down and look through to see, did we cover all of our bases? So we know that many of you implemented policies and procedures at the start of COVID-19, but just making sure that we are checking all the boxes and that we've completed these things. And if you're not, how can we implement that to make sure that we have more resilience in the coming months? Because we know it will be quite a few months until we're in the clear again. So providing factual information quickly and efficiently, encouraging vaccinations and healthy activities among your staff. You also want to make sure that staff know what's expected of them before a pandemic. We're now in the middle of a pandemic, but just revisiting the responsibilities of each staff member and if they think that this is sustainable. Will they be able to complete these additional services for the rest of the time that's required of them? And there are suggestions throughout the toolkit about ways you can alter your HR policies during a pandemic so that you are keeping your staff as safe as possible. One of the biggest ways to increase your continuity and your resilience is to cross-train your staff. In any emergency, the more of your staff know how to complete the different essential functions, the better off you'll fare. So make sure that your staff, if they aren't already, that they create opportunities to train other staff in their tasks that they're completing where time allows. I know we're in the middle of a pandemic now, but this is something that you can look at implementing as a way to be a prepared congregation. So in being prepared, a big piece of that is making sure that your staff is cross-trained and knows how to do a few of the different essential functions. You also want to notify them as soon as possible when there's a change in leadership or authority. And also make your staff aware of any medical, mental health, or spiritual or pastoral care your congregation or partner organizations might provide. So this is also a great thing to revisit now that we're a year into this pandemic. What resources are you able to provide your staff or your volunteers? And can you make certain resources available to them? So the toolkit also plans for continuity around your worship and religious gatherings. And so this is a list here of bullet points about ways that you can alter your services. I'm sure many of you have followed these bullet points exactly. There are also considerations during a pandemic about religious foods and diets and how potentially supply chains might impact your ability to get certain things. And also spiritual care. We know that during a pandemic, the need for spiritual care will rise. And so there's a whole section on this in the toolkit about spiritual care. And also tied in with that, just the emotional support that's required during a pandemic. And so planning for that and how you can realistically shift other responsibilities to make sure that you're able to cover this one. Considerations during a pandemic include providing spiritual care to the sick, dying, and bereaved. And the toolkit shares about those things that we know many of you know firsthand. It also touches on funeral, memorials, and mourning rituals, and how those rituals might have to be changed during a pandemic. So we know during COVID-19, in-person gatherings were strongly discouraged, and there were limits on how many people could attend funerals. And so we want to just plan for that if we can in advance, and also recognize what we have been doing instead and assess, is this working for us? And is this something that we can sustain for the next few months? So overall, once you've looked at your essential functions and how the work has really been distributed throughout this pandemic, we want to look at how you can maintain and adjust those essential functions. So in certain functions, you need to plan for increased demand. Now, I think the increased demand will be, for many of us, communications about the vaccine. And in that case, you want to identify alternate service sites and models. So knowing that your congregants will want to know information about the vaccine, hope that you have a staff person who's dedicated to looking at all of the information that the health department is able to provide. In New York City, if there are any information that the governor is putting out, or the CDC. So planning for that increased demand in advance. If you're able to develop partnerships with other faith communities for providing these essential services, that means that you can kind of share the load. So if you have a sister church, or if you have a partnership with a congregation, even across the country, if you all are able to create one Zoom link and have kind of a prayer meeting that one person runs rather than having two happening at the same time that are run. It kind of helps you share the load of the essential functions and be smart about where you're spending your time. All right. So this is continued about how you can maintain and adjust your essential functions. Within your essential services, so once you've identified your essential functions, it's great that you have a list of essential ones that you know you're going to continue to run no matter what and plan around. But in addition, we want you to prioritize those and develop a protocol about when to give more resources to an essential function that's higher on the priority list if you need to concentrate your resources there. So in the example here, it is to temporarily suspend services such as weddings and birth rituals to concentrate on resources for care for the sick, grieving family members, and congregants who develop special needs. So we know that during a pandemic, you might have increased need in that area, and that essential function will have a higher priority than weddings and birth rituals, which might still be essential, but will be a lower priority. All right, I think I've done enough talking. I would like to know in the chat, how has your congregation adjusted your services and rituals throughout COVID-19? So we gave examples in the toolkit, but I think the best learning comes from each other and comes from us here in the room. And I've learned about some of the most innovative practices here in webinars. So I'm curious to know, what are some innovative practices you all have utilized to continue to provide spiritual care to your congregants, to create opportunities for peer support among your congregants and where they can support each other emotionally. I'll go ahead and open the chat and see if I can read anything out to the group. I'm not seeing anything yet, but I'm curious to know, are there ways you've altered weddings, for example? All right, Denine's here. She said Arvern Church of God has gone from 5 services a week to 2 in person. Great, yeah, so you're altering Sunday morning and Wednesday night and spreading those times out to make sure that it's increasing safety for people. Absolutely. All right, Reverend Benkis, encouraging people to be in ministry themselves. Great. For us, this has been around emergency food, has been key to keeping people engaged and spiritually strong. Absolutely. Brenda writes, their congregation uses Zoom for worship services, Bible study, and prayer services. Excellent. They only gather for giving out to the community, and they mail out or deliver Bible study information. Excellent. All right. I love the use of traditional mail. I've also heard of pastors mailing letters to their congregants for individual communication during COVID-19 because the virtual online technology wasn't best suited for their congregants. All right. Althelia writes about Sunday services on Zoom. Thursday, they use a free conference call. They restarted on Sunday school using Zoom on Saturdays. Right, so you're altering the days and making it work for people. Excellent. People write Zoom services, Miss Moore, Sunday services at a later time. They have Zoom funeral services, right, making it accessible for people. It's a tough call to make. Dr. Hagler writes that Antioch Baptist Church of Corona live streams weddings and funerals so people can be a part of those celebrations. Absolutely. Oh, Tom Benkus writes, some of our churches have gone on Sunday walks. Excellent. If you can do that safely, outdoors, distanced, masked, excellent. A lot of Zoom, excellent. And calling members who aren't able to get on the internet. Absolutely. So Cynthia Jackson points out that some forms of communication won't work for all. And so making sure that we're not letting people slip through the cracks, especially now that we're kind of in the swing of things, reassessing and making sure who have we been missing lately? And is there a way we can reach out to them? All right, we've got Facebook Live for Sunday service and a conference line. Gabrielle writes, in Germany, they had live services with high distance and no singing, only a soloist far from others. Yep. I know the singing has been a really tough call for congregations throughout COVID. And we've seen how it's higher risk, and how can we work around that with our worship services. I see a virtual Christmas concert. Excellent. Yeah, live service over Zoom for those mandated to stay home. Janine also brings up a good point. Even once the vaccine is being distributed, and once things are starting to get safer, there are still going to be those high-risk individuals who, for whatever reason, were unable to get the vaccine, and we need to make sure that we're continuing to provide those services, whether it's a Zoom link for them, to make sure that we're not excluding some of our highest risk from worshiping. All right. I see a few more before we keep moving. They've become an exclusively Zoom church here. Sharon Williams wrote that they've been homeless while waiting to move into their new building. So main challenge is to make generate fellowship feelings in virtual services and rituals. Yes, absolutely. And Deneen writes, elderly minister remaining active through phone ministry with counseling. Excellent. More snail mail, mailing church school lessons to members. And St. John's the Baptist Parish has weekly Live and Facebook Live using protocols. All right. Thank you all for joining in the conversation and sharing how you all have altered your events. It's good to see all the ways that we've been flexible and the ways that we're making it work. And I would love to hear I always love to hear about ways that we can make Zoom feel more personable, and how to make these online gatherings feel like they have meaning. So I hope we can continue to share those practices throughout the pandemic. All right, so wrapping up our planning for continuity, we have congregational and household planning, which these two things listed here are things that we know you all have followed. These are the guidelines for making sure you stay home if you're sick, and the protocol for if people within the household are ill. All right, so in planning for your continuity in a pandemic, you'll also want to keep in mind supplies and equipment. We know that PPE has been hard to come by, and we've tried to help aid in getting PPE to congregations. You'll want to budget for increased technology. So if you've had to purchase more laptops or tablets for your clergy to stay in contact with their congregants, and other forms of telecommunications, a Zoom account. Many of you said that you were utilizing Zoom, so budgeting for that Zoom account. Also a budget line for hygiene supplies if you're utilizing any portion of your physical space. The increased need in hand sanitizer and cleaning supplies. And ritual items or materials to deliver so congregants can worship at home. So there's a section in the toolkit about costs, and I'm really glad that they did this, because when we first started teaching continuity planning in the pandemic, one of the biggest hurdles for congregations was how to manage the finances and how to account for additional costs. So none of the actions that we've discussed can be successfully performed unless you plan for the cost. And we know that congregations are acutely aware of this a year into the pandemic. So I'm glad that there is guidance around how to plan for costs and anticipating the additional costs that might happen during a pandemic. You also want to consider income that your congregation might lose during a pandemic. I know that towards the beginning, much of the plate offering, the loss of a plate offering each week was really detrimental to congregations. So before you proceed with any of the essential functions that you've identified in the previous sections, you want to ask yourself the following questions before making a purchase. So does your staff need this to continue to function? Is this necessary for the essential function? Will not having this put people's health at risk? Will it, we want to make sure that you're continuing to keep people safe. Is your action or purchase based on facts? And will your community actually use it? I know at the start of the pandemic, NIDIS purchased a Zoom account. And at the start, we thought we needed a webinar license to offer webinars. And as we kind of settled into how we were supporting the faith community in New York City, we realized, oh, this was actually, we have an extra license. We can take this one off. So we tried to gauge what we actually needed, and we reassessed and made sure that we were actually using the things that we had ramped up on for the pandemic. I am happy to note that there is a section on mental and spiritual health in this toolkit. There has been a mental health toolkit written for faith leaders that NIDIS participated in earlier this year, but some of that information is included here in this planning toolkit. So we know that the pandemic is a time of high stress, and it'll impact our mental and spiritual health. So the toolkit encourages staff to look to one another for emotional support, and to consider instituting a buddy system where each staff member can choose someone to provide that support. There are a series of self-care tips for you and your staff and your volunteers. We hope that you are able to visit these with all of your staff and volunteers and determine if these things are taking place and how your congregation can support your staff. There are also self-care tips that are listed here, especially managing your workload. If you haven't assessed people's workload and determined if there's time and space for rest and how to prioritize their tasks, it's always a good time to do that. All right. So we hope that there are ways that your leadership can delegate when they feel overwhelmed. So in wrapping up the content for this section, we hope that you're able to work with either your judicatory body, your religious network, or a partner in delegating tasks among your leadership. There's power in partnership. So combining your activities in a way that allows leadership to share responsibilities and split time. I mentioned this briefly before, but if your congregation has other branches in different parts of the region or the country, consider working with them to have leadership from a less affected area come in to help. So I know at the start of the pandemic, we had healthcare workers from other parts of the country come to New York. Unfortunately now, it seems that the burden of COVID-19 is spread among the states. But if there are ways to share leadership across the country, if possible, especially now that a lot of us are doing Zoom remote platforms. And if it is possible, planning to have your leadership work in rotating shifts so that your leadership can rely on a break and they know when their break is coming. So if a rotation is feasible, that means that your pastor pastors for another church one week and allows that pastor to take a break 1 week a month, knowing that that one Sunday he has rest for that week. That type of rotating shift can be really important. And knowing that you can rely on that break means that you have the stamina to keep going for longer. It builds your resilience and it prevents burnout. So this is what we're hoping to encourage, especially a year into this pandemic. NYC Well has put out really great tip sheets on recognizing stress and staying mentally healthy during a pandemic. In my opinion, they're very upfront and real about the burden that the pandemic has taken on people's health. And so this link will be in the slides that we send out to you in the email. And we hope that it's of use to you in finding some resources. And even if that means starting the conversation with your staff or with your clergy by sitting down with one of these sheets and reading through it and marking what they identify with, anything to start the conversation to figure out how we can best support each other. All right, so we have a moment of participation again. We love to highlight self-care at Nidus. This was an initiative that we had earlier this year. And we love to encourage self-care among clergy and among faith leaders. So how are you practicing self-care throughout COVID-19 in this pandemic? We know how important self-care is to maintaining your own emotional, spiritual, and physical wellness, that you can serve your community. So I'll open up the chat again, and I would love to read your self-care practices. I know for me, my self-care, while I wait for some of them to get typed in, I adopted a dog mid-pandemic. My first dog, and yes, Reverend Benkus, walking the dog. Yes, walking my dog has been a way that I've been able to self-care. He needs to be walked at the same time every day. It's given me a schedule and gotten me outside in a way that I wouldn't have done for myself. So I'm grateful for that. All right, I see water, vitamins, decluttered and purchased furnishings so we are more comfortable. Absolutely. It's so important. We're spending so much more time in our space now. So if you're able to afford that, that's excellent. I see Deneen Ferguson is a foodie, and she still finds a way to go out with close friends and go to the school gym to roller skate alone. Excellent. I love that. Absolutely. That's great. I love finding ways to utilize the outdoor spaces in ways that work for us. And if there are large indoor spaces with very few people, if you're able to utilize those as well. Yep, turning everything off, especially our devices. We've gotten so used to being on a device all the time. Listening to music, speaking with those you haven't connected with in a long time. Decluttering, that's the second person who's talked about decluttering their space. Excellent. And praying. Playing the keyboard and turning off phone and laptop. Absolutely. I see stretching and journaling. That's a new one. Excellent. Group texting and also taking a nap. Yes, absolutely. These are great. Personal prayer in the morning and walking through Prospect Park. Yes. Even in the cold and the winter, there's something about being outside if you're able to withstand it. Coloring, creative. I love that. Keep your hands busy. Excellent. All right. So these are some great self-care. I love hearing. I'm inspired by Deneen's roller skating. I would love to roller skate. Essential vitamins, exercise. I need to find the motivation for the exercise. But yes, I love that other people are exercising. And a prayer line, absolutely. I heard of a church that was opening a prayer line in the mornings and having that conference line open for people to share prayer requests with the pastor, and just knowing that you have that set time. I think they said it was from 8 to 9 a.m. every morning that they could call in and feel that personal connection and know that it was there to support them. Having that constant rhythm, I think, allows people to feel really supported. All right, so wrapping up, the supplemental documents at the end of the toolkit are listed here. These are the worksheets that will help you create the plan that you're looking for, and I will open the floor for any Q&A. Are there any questions about how to use this toolkit? I would love to hear from you all if you think it will be useful or which pieces you might be useful. Or if there was anything that you thought we would cover and we didn't cover. We're getting to the vaccine still, but you can go ahead and unmute. All right, it must have been very thorough. If questions do come up, you will be receiving an email from Nidus shortly after this. And so if you would like to ask any questions there at that time, that'll be available. All right. So we'll jump into some vaccine updates. I'll cover a few things and then I'll pass it off to my colleague Yeshi Braddock from the Health Department, New York City Health Department. So we had some questions when you registered about the vaccine and how it was developed. And so the FDA has this great graphic that sums it up about the 3 different phases for vaccine production and what's required of each phase. And then the FDA licenses the vaccine only if it's safe and effective and if the benefits outweigh the risks. It also talks about vaccine production. So they're made in batches and each lot must be tested to make sure that it's safe. And then there's periodic checks and inspections to make sure the facilities have quality and safety. So this graphic will be in the slides that we share with you all. And if you have any people asking questions around it, there's also a link at the bottom to find more information about the FDA vaccine trials. We had questions about how we knew the vaccine was safe for people of Black or African American descent. And so we shared some information that we know about the 2 vaccine trials that have been approved of the 2 vaccines, the Pfizer vaccine and the Moderna vaccine that are currently approved by the FDA and being administered. So in the study that took place where I believe in the Pfizer vaccine trial, it was 44,000 people took place in the study. 9.8% of the study participants were of Black or African American descent. So this is almost 10%. This almost matches the US population. The US population has 13% people of Black or African American descent. And the study's goal was to have as representative of a sample as possible participating in the study. So they did try to match the race and ethnicity of people participating to make sure that the results could be applied throughout the population. So in the Moderna vaccine trial, 33,000 people participated, and the numbers on the next slide so you can see it. But they also had a similar percentage of Black or African American people participating in the study, and their reactions to the vaccine were noted just the same as everyone else in the study. So there are currently 2 COVID-19 vaccines that are approved for emergency use by the FDA. In the clinical studies, both vaccines were more than 94% effective at protecting participants from COVID-19. So some frequently asked questions from your registrations today. One question was, are the vaccines safe? And so there are a few different ways we can discuss safety. So we have them listed out here. You cannot get COVID-19 from the vaccine. The vaccine does not contain the virus. The vaccine does have a piece of mRNA. This RNA teaches your body's immune system how to fight the virus. So it teaches your body how to create the antibodies to fight the virus if you're exposed to it. More on safety, I think there's a question about, well, it was developed so quickly. So we wanted to point out that researchers have been working on vaccines for coronaviruses in general for years. So this research wasn't started from scratch. And while mRNA is a new type of vaccine technology, it's been studied for over 30 years. In addition to discussing safety, I think there are questions about, well, I don't want to be one of the first people to get it, or I'm just going to wait and see how other people around me respond first. A lot of hesitation about wanting to be one of the first. And so we do know that in the clinical trials, 44,000 people volunteered in the Pfizer vaccine trial and 33,000 in the Moderna vaccine trial. So you would be far from the first to be receiving it. And the evidence from those studies was closely reviewed by the FDA as well as independent organizations. So this all speaks to the safety question. We did get a question about side effects, and so we share some information that's readily available about the side effects. Common side effects are soreness at the site of the injection, headache, body aches, tiredness, and fever. These side effects are usually mild to moderate, and I think the most important thing to note is that they're in a limited time frame. they're finite. So they start within the first 3 days after getting the shot. It's most common to happen the day after your vaccination, and they last for 1 to 2 days. So these are side effects that will have a short amount of time that they'll affect you. They're more common after your second dose. So we know that both of the vaccines that are approved right now for use in the US require 2 doses. So the side effects are occurring more commonly after the second dose. And the side effects were also less common in older adults in both of the clinical trials. So if you have any concerns about the side effects that you might experience or that you are experiencing, you can always call your healthcare provider, especially if they don't go away after a few days, or if the redness or soreness at the site of the injection increases. You can also talk to your healthcare provider about taking over-the-counter medicine like Tylenol or Advil, and that will help relieve any discomfort or the side effects that we listed beforehand. All right, one more question, I believe, from the registrations, and then I'm keeping an eye on the chat, so hopefully we'll get all the questions answered. So if vaccines are free, why are providers asking people for their insurance? That's a great question. The vaccine is currently free for everyone. If you have insurance, it might be billed to that insurance, but you won't be charged a copay or other fee. Currently in New York, you do not need to show your immigration status to be vaccinated. And getting vaccinated is not a public benefit under the public charge rules, so your immigration application or status won't be impacted by getting a vaccine. And your privacy is also protected when you receive the vaccine, so you're confident, it ensures confidentiality of your personal information. So we have some key messages that we just reviewed together, and I would love to pass it to my colleague Yeshi to share information from New York City Department of Health and Mental Hygiene around the vaccine now. So I'll go ahead and hand it to you, Yeshi.
Thanks, Helena. Good afternoon, although when it gets dark at 4, I feel like evening is probably a better salutation. So Helena, you covered many of the key updates that I would give. I just want to reinforce that the vaccine is safe. I know, being Black myself, I've already gotten the shot. I work at the vaccine hubs just for transparency. And as a public health professional, I'm quite versed in the history of this nation and testing things on people of color. And so while, maybe seeing 50% of the folks who participated would feel slightly reassuring, we do have to remember that these folks are volunteers, and I'm sure they did seek to have a greater percentage. But I think, again, rightfully so, a lot of Black Americans probably felt like they did not want to be part of a trial, right? And so that's just something to keep in mind. I do want to say that we know at this point over 1 million New Yorkers have received the vaccine. And we also do know factually that no one has died from either Pfizer or Moderna. And in the news, I'm sure you all have seen recently that elderly folks were dying in Europe. But it's come back that these folks, unfortunately, were older and they had a preponderance of very, very severe health ailments, and has been determined that they weren't connected to the vaccine that they received. And it is hard, to trust the news. I know for a lot of us, just with everything that's been happening in the world and in our nation. But I will say that having a nearly 10% amount of folks is substantial, and speaks of progress. And you have to think about, that's over nearly 10,000 Black African Americans have taken this vaccine, and none of them have reported any, side effects that would have limited their lives or decreased the quality of their lives. And it is also important to note that for Moderna, I think 6% of folks express feeling the side effects. So that is just 6%. And again, as Helena said, the side effects should happen really in a small window. And if they feel severe, please go see your primary care, go to the emergency room. And if you're a person who is prone to anaphylaxis, or, you know, when you read the ingredients in the vaccinations and they're all listed on the FDA and CDC sites, so you can see what's in them if you have severe allergies, please do not get the vaccine if you are allergic to anything that's inside of it. And do, you know, watch your reactions if you're a person who's prone to having anaphylaxis if you decide to go get the vaccine. Um, and again, I think sharing this information with our communities is the most important. I think having the agency to make those decisions and the factual data is super important. And so I'm grateful that you all are here, because you are the leaders of so many communities. And, you know, again, everyone will make their own decision, but I'm glad to know that they'll be getting the right facts from all of you. So even with the vaccine, I guess the biggest thing that we don't want people to forget also is to just remain with the core four, because what is not yet been determined by either of the vaccines is, if I have the vaccine and I'm now vaccinated, it is not yet determined whether or not I could still um, pass the virus on. And so the way that coronavirus works, it can live in your nasal passages. It doesn't have to mean that you're actively sick with it. But you could still pass it on even though you won't be sick with it. And so we really still ask folks to keep up with their core four, still wash your hands, social distance, wear your masks. And then the more of us that have it, the closer we'll get to creating a somewhat herd immunity. Full herd immunity will take some time because it requires a really large percentage of our population to be immune to COVID-19. And that'll take some time. As we all know, we've only done 1/8 of the population in New York City, if we say 1 million, right? Because there's about 8 million folks in New York City. And both Pfizer and Moderna have now begun trials for the youth populations, so under 15, under 16 for Pfizer, and under 18 for Moderna, are now in the process of seeking applicants to test it for younger folks. So right now, only adults and very older teens can be vaccinated with both the Pfizer and the Moderna. And there are several other vaccines still in trial, the AstraZeneca one, there's a Janssen one, and they're all in stage 3. So I'm sure we'll all be hearing more about that. And as we know more and as they are approved or not approved, we will make sure to get that information to NIDIS and out to everyone. So I guess the other thing, I'm not looking at the chat, the questions. I can put my mic closer. I see that the volume is low. Is that better? Ms. Jackson, can you hear me better? Because I feel like I have my volume at full.
Yeah, you're good now.
Okay, great, wonderful. So for eligibility, I know that's a question that we've been getting. It is listed. I think we have a slide on it. These are the populations that are currently eligible. I don't know when clergy specifically will be eligible. If you fit into any of these listed categories, please do make an appointment. The appointment should resume sometime this week. We had to reschedule things because, as we know, we are actively producing vaccine as we speak. It is not as if there's unfortunately stores just waiting for us to use, but do schedule your vaccination appointment. There are so many vaccine hubs that are run by the DOHMH. There are some that are run by H&H. There are private clinics that run it. And as Helena said, it is free. So if you're on the DOH's site and they ask you if you have insurance, and you do, but you don't feel like putting in all the stuff, and it gets annoying, because that's what happened to me, and I'm a city employee, I 100% have insurance. I just said no, because all the boxes they wanted were not on my insurance card, and I was like, this is very frustrating. And so I just want to be honest that this is a new system. We are reiterating as we go. In my opinion, the user should have the easiest experience, and those who work behind the scenes should take on more burden. And so hopefully we'll get our system to a place where that is true but currently that is not as true as I would like it. So if you are trying to make an appointment and you're like, oh, I have insurance, and then you fill it out and they're like, no, we need this number, and you're like, I have no idea where that is, just hit no. Just hit no, and it won't matter, and you can schedule your appointment anyway. I don't know if that's a pro tip, but it's a tip that I am giving out to you all because it is frustrating. And the other thing I really want to highlight for our system is it is not standard in the sense that you think that you have an appointment, and then it says all these data points and you're like, yeah, that's perfect, and then at the top it says make my appointment. That's not the standard protocol for most of us navigating websites. If everything else has been on the bottom, you just hit like next and submit. No, our website has its final submit at the top of a page and it says make my appointment. Please click that if you're using ours, because otherwise you will screenshot that, but you'll get to our site and you won't have an appointment, and we'll be sad and you'll be angry because it is very difficult for us to fix that error. So you will know for sure that you have an appointment because you'll get a confirmation email. So if you don't get a confirmation email, then that means you didn't hit that button at the top at the last page. I've been at the vaccine hubs over this month, and so that is just sort of the thing that's been reoccurring the most, and particularly for our elderly. You know, it's tricky, right? It's just tricky. There's a lot of questions. There's a lot of yes, no things. It's really easy for elderly folks. If it's easy for me, it's easy for elderly folks to not hit all the right buttons. So I just want to put that out there as you are working in your communities and with your members, that these things can get missed, and then people wait online for an hour in the cold, and they may not be able to get their vaccine, and that as was in the chat, is the worst thing ever because our communities have been disproportionately affected by this virus, as most things that happen in this nation, unfortunately. So I think of all the people who signed up for the trial who were Black and African American, and I am ever so grateful that they did it, because it gives me the belief that it's okay to get the shot, and I have the shot, and advocate for everyone that I know to get it, because that has not always been true. And for a lot of them, that was probably a lot of faith to step out on. So that being said, I think, you know, as we move on, there's going to be more and more vaccines, and it's always going to be up to you to decide, you know, which one is for you. But do make sure that you are going to our websites, sending NIDIS questions. They send them to us, and we will get back all the most factual information that we have, because that's the best way for all of us to make decisions, is with the facts and with our own sort of moral compass. Let me see if there are any other really important things that they have given me to say. Oh, a good thing to hear is that the Moderna vaccine is effective against the UK and South African SARS-CoV-2 variants, but the vaccine effectiveness could be reduced. Moderna is testing a booster aimed at the South African variant in a phased trial. And so that's a good thing to know. We hear about all these new various strains that are out, and people are wondering, will my vaccine be good enough for these variants? The answer is that, just like with the flu, there will be many variants, and the flu shot we get helps us, if it's not for the variants that we're exposed to, fight it off or have a less severe experience. So even if, you know, these initial vaccines don't vaccinate us fully or give us full immunity from all the other variants that might spring up through the course of the year, or, I mean, honestly, the rest of our lives, it will make us fight it better, because they are still related viruses. So it's still important to get this vaccine, just like it's still important to get the flu vaccine. Not because you may never be exposed to a variant of flu that you can't get, but that it will make it easier for you to fight that flu, and be less lay low, miss less work, miss work less, have a better experience with the flu. Unfortunately, I've not had COVID, but I have had the flu before. And for anyone who ever says, oh, it's just the flu, I always think they have literally never had the flu, if that is how they feel about it, because it is no fun. It is awful. And so just as I advocate for the flu vaccine, it's not too late to get that either. But I will say, if you are going to get vaccinated with the COVID vaccine, you cannot get another vaccination within 2 weeks of getting the COVID one. So if you sign up, but you just got a tetanus because everyone's been cleaning and decluttering and doing all these lovely things, but you stepped on a nail because life is full of things like that, and you got a tetanus, they're going to tell you that you have to wait 2 weeks after your tetanus to get your COVID vaccine. So I'm just putting that out there again, another pro tip. If for whatever the reasons are that you get to travel somewhere that you need a vaccine, maybe you're doing some really good missions work or something, which sounds amazing, traveling, um, and you want to get your COVID one, you should get those other vaccines after you finish getting all of your COVID shots, because you can't get a vaccine within 2 weeks of that. So just another thing to consider, or just to know as you're planning and letting your congregation know about barriers and or things to be aware of when they're scheduling for their vaccinations.
Thank you, Yeshi. We had 2 questions come in the chat.
Yeah.
How long at this time?
Well, I mean, I'm going to be honest. I feel like right now it is probably quite difficult to get an appointment through the DOHMH website, mostly because I think we're waiting for our next shipment of vaccine. I do know we should be getting some soon. I don't know the exact date. I think we're scheduled to reopen again on January 28th, which is this week. But we are scheduled to. We will see if that's what happens. So I think it is sort of a refresh game. So I know that sounds awful, but it's one of those things that you go and there won't be an appointment, and then you'll like hit refresh, and then maybe someone will cancel and one will pop up at the moment. So it's not very, very easy, but I think I'm crossing my fingers, my whole body, that as we have a new president and a new federal agenda around vaccinations and vaccine production, that will not be the case much longer, that it will ramp up, and that we will have the supply we need to vaccinate our communities. So I will say it's not that easy, but I will also say it is worth every minute that it takes for you to get that done. Also, I know that H&H Health and Hospitals, they are also giving out vaccines, and they do have some 24-hour places, and that I've heard from folks that I've worked with that the later spots don't have as many people, unsurprisingly. So if you have the privilege and the access to go to one of the 24-hour places, and you don't mind being up a little bit later, that might be a better option for some of it. I see if you make an appointment and the supply runs out with a prior appointment date. So if the supply runs out, which it has already, they do reschedule you, and they will let you know through the system when that will be. So as far as I know right now, and I want to say that as far as I know right now, that is still true, that we are honoring those that we've already had to reschedule. I do not know what the protocol will be moving forward. I will hope that we would keep the honor system up and figure out a way, because again, it is not anyone's fault. I mean, ours or community members' fault that we don't have enough supply. So for the Pfizer, it is 21 days, and for the Moderna, it is 28 days. So, if you got your vaccine on January 1st for Pfizer, then 21 days later, so the 22nd or so, you should get your second shot. And for the Moderna, it would be a full month later that you should get your second shot. And whatever site that you go to, they should give you a little square card. It's a little white card. I have mine on my table. I don't want to lose it because I'm good at that. So here's this little card that they give you. And so if you have to go take care of your loved ones who live in a different state for whatever reasons, because we're all doing so many things and stretched so thin, but you have to be vaccinated with Moderna, they should also write that down on this card, or Pfizer, whichever one it is. When you take this, if you go to Georgia and go to a clinic there, then they know what you need and when you got your dose. And if you're off by a week or so, they'll be able to say, you need to reschedule or whatever. So you want to make sure once you get your first dose card that you keep it with you. And it should definitely say the day that you got it, what it was, and have the healthcare professional's signature on it. So that's that card. Is there anything else? Oh, someone asked for my pro tip. Again, I feel like I've rattled off a few, but the biggest pro tip that I want to say is when you're in the DOHMH's / New York City system making your appointment, it will ask you for so many things because the city, right? And you will get to a page that says, I've scheduled my appointment for February 15th at, Adelaide Stevenson High School. This is the address for, 1:20 p.m., blah, blah. And you'll be like, great. Yep, that's exactly what I want. That's my appointment. Because there's going to be nothing at the bottom of the page for you to hit submit for. So you think that's your appointment. You're not finished. At that top, there will be a little blue box that says make my appointment. I know that is supposed to make people think they need to click it, but we are beings of habit, and habit says you hit submit at the bottom, not the top. And I don't always read fine print myself either. So hit that blue box at the top that says make my appointment. That is how you know you've made it. You should, within minutes, get a confirmation email saying this is your appointment ID number. Here is your QR code. Here's all of the details. If you do not get that, you did not make your appointment. And I want to be clear that when you make an account in our system, you do get an email and it says you've made an account. Some people don't recognize that is separate. So you just get an email saying, thanks for signing up to the DOHMH's vaccine hub. And then the next email you should get is, you have scheduled your appointment. Here is your appointment ID number and all the details of your appointment. If you don't get that second email, then that means you did not confirm your appointment. And so you need to rush back and do it again. The other thing that's important to know is that you can only have one email attached to one person. So if you're going to make an appointment for anyone who's dependent on you or might have some tech challenges, you'll need their email, or you'll have to create some dummy, well, I guess they won't be dummy, right? But some emails for them so that they have an email attached to their name. You can't use your email twice. So we get a lot of folks coming in saying, that's not me, that's my daughter. That's not me, that's my grandson, because the grandson or the daughter made the appointment, but you can't do that instead of someone. You have to be connected to the email. So that's also important to know if you're going to be making accounts and appointments for people who are dependent on you. Obviously, it's going to be true once kids can get it that you will also have to, if your little baby doesn't have an email address, at 4 years old, not surprising, but you might have to make them one for the vaccine if by the time this vaccine becomes available, it's not maybe at all of the primary care doctors yet, right? So once all of your primary care has it and things like that, I feel like you won't need our system as much. So, but if the trials for the youth are approved sooner than it's super widespread, you might still have to use our system. So just know about the email thing.
Thank you, Yeshi. I think we're at time, but thank you so much for all of the really useful information you shared. I think your firsthand experience allows for us to get lots of pro tips and make sure that we are getting our appointments as efficiently as possible. I really appreciate the time you've taken today with us. Thank you everyone for attending this webinar. We hope that the information is helpful to you. We hope it serves your congregation well and enables you and strengthens you to continue doing the good work you've been doing. You'll receive an email from NIDIS with the information all wrapped up neatly. Please fill out the evaluation. It will help us make this webinar and this toolkit better for everyone coming after you. So thank you so much for taking the time today. And please email us, let us know if you use the toolkit, how it's working for you, if you need any assistance. And NIDIS will make sure to follow up with you. So thank you for joining us today. I wish you all well this evening. So take care. Bye, everyone.
Bye. Thank you. Thank you so much for today. Have a great evening.
Thank you. Blessings to
Thank
everybody.
you.
Thank you.
Good
Thank
night.
you.
Good
Bye.
night.
Thank you.
Thank you. Be safe. Everyone bless.